Hello everyone, thank you for coming to this video. I'm Han Wang. Today, I'd like to present our research, which is Software Engineers' Response to Public Crisis, Lessons Learned from Spontaneously Building an Informative COVID-19 Dashboard. The rest of the authors are Chao, Chunyang, Brock, Shuping, and Zhou. Here is an outline of this paper. We first discuss the introduction and motivation of this paper. Then we introduce the dashboard characteristics with the overall steps of how the authors developed it and impact it has been made to the public. Last but not least, we summarized 9 lessons learned during the development based on the 3 roles, which are developers, researchers, and instructors. Well, as we all know, that the coronavirus has spread quickly around the world. Up to the moment as I made this video, there are over 500 million confirmed cases, and we have lost 6 million lives. Government have taken actions such as lockdowns, border closures, working from home, enforcing social distancing, and wearing the masks, which have influenced people all over the world. At first, as we know little about the virus, people are urged to get the latest news about the COVID. For example, how many new confirmed cases are there every day? What are the symptoms if I test positive? And how can we prevent from getting it? Well, to get such information, there are several ways. For example, there are government release, there are social media, for example, Twitter, Facebook, YouTube, and there are also like traditional TV news. But there are some problems. For A, there are no united criteria. Different channels have their own way to present the data. And because of the content limitations, there are no proper visualizations. And for some channels, there are no frequent updates. Users cannot check the data wherever or whenever they want. Besides, it is hard for users to just look at the part that they are interested in. Well, therefore, there are a lot of COVID-19 information dashboard being developed during this time. For example, there are very famous one, developed by Johns Hopkins University. There is like a 1.3 acres developed for US. The Dingjiang doctors works for the Chinese people. In this work, we built our COVID-19 dashboard, which is called COVID-19-AU. This is a COVID-19 dashboard working for Australia. Here is an overview of our dashboard. It contains the homepage, which illustrates the key data and visualizations. The information page contains the official instructions from government, and the news page shows the live news feed and Twitter. Here are the project characteristics. We firstly published the website on mid-March 2020. As far as we know, this is one of the first COVID-19 informative dashboard in Australia. We have helps from over 200 volunteers from 12 different nations, and most of them are undergraduate or graduate students from universities in Australia. The dashboard provides information including the latest number of total cases, death, recovery, vaccination, etc. For each type of data, we have its proper data visualizations. There's also a map of cases distribution in city and suburb level. We have flat information with confirmed cases. Besides, for the information page, there are suggestions from WHO for dealing with COVID-19 and local hospitals' contact information. We also have the latest news from the well-known online news groups and tweets from the official website. And since the release of our website, we have a large number of users and page views, as you can see in this figure. Although most of the users are from Australia, there are also others from a total of 184 different countries and areas around the world. Based on our analysis, they have friends or family members living in Australia. From different channels, we have received much feedback from users aged from 10 to 80. Around 81% of the users feel excellent or very good about our website. The feedback including appreciation letters, bug or error reports, and feature requests. How it works? Well, our development circle starts with team building. As most of our team members are volunteer students, they would also need to focus on their classes first and then help with the development. So we have to constantly find new members to take place of some old volunteers who would need to deal with their assignment or exam first. We adopt the Agile programming circle in order to deliver value and responses to the requirements frequently. Well, first there are data team. They collect data from a list of trustworthy organizations first, and then depends on different types of data, we apply different visualizations to them. There is also a requirement team come up with new functionalities based on feedback from the existing users or content updates from other COVID dashboards. And then we apply all those to the web development. After the development, we will have internal and external tests before the final release. We keep the sprints as short as possible to make sure that new features meet the public needs on time. With our first-hand experience and theories in software development, we summarized 9 lessons that are highly related to the pandemic itself. We categorized the lessons into 3 aspects: developers, researchers, and instructors. We believe that the lessons should be helpful with people who work in the same areas respectively. The first lesson is to be careful about sensitive data. Due to the sensitivity of the COVID-19 data, any errors in the data may occur in social panic or spread fast among people. An example is when developing the case map. We firstly use the map markers to annotate the virus states in each city, as you can see in the old design. The red cross icons represents the graphic location of a COVID-19 clinic, whereas the green ones represent the number of confirmed cases in that suburb. However, with this design, we have received feedback from users saying, for example, one of the markers was pointed right on his form, which he was definitely not happy with it. We also received feedback like a pointer was pointed inside a national park, which supposed to be no one lives in there, which confused the users whether there has been a confirmed cases in the park. Therefore, we changed the design to the updated version. We use the shades of red to represent confirmed cases in a certain area to avoid ambiguous and misunderstanding. The second lesson is to use domain-specific terms. Well, in the development of such domain-specific app, it is crucial to choose professional terms rather than use some random words that may cause ambiguity and results in losing trust in the product. In our development experience, we once used the term existing case to describe the confirmed cases that have not recovered yet. Though all of the developers in our team can understand it well, we have received a lot of feedback asking what does that mean, as they thought it is the same with the term confirmed case. There are some feedback even suspect that we are using the fraud data because of the term of using existing case. We then realize that for this kind of the data, it is there's a more professional term as active case. We quickly change the wording of it and add an explanation under the column to explain to the users who are still not clear about it. Lesson 3, keep users calm during the pandemic. While the coronavirus not only has a physical impact to the patients, but also brings heavy mental pressure, especially to people in lockdown or quarantine. When developing the COVID-19 website, we learned that the increasing number of deaths or confirmed numbers could cause people to feel anxious or worried. In order to mitigate this, developers should also consider to keep users calm when developing such websites. Lesson 4, develop different features for different phases of the pandemic. We developed the features that are only needed by now. Since the pandemic starts with no signs and it spreads quickly around the world, there's not enough time for developers to develop all the features and release them once for all. In our practice, we choose the features that are needed the most at the moment based on different phases of the pandemic, and we keep it continuous development, which improves the efficiency of the development and also increases the developers' motivation. During the development of the dashboard, we have collected user feedback and their usage activities through Google Analysis. By analyzing such kind of data, we summarized lessons for researchers. Lesson 5, people's information needs about COVID-19. As can be seen on the left-hand side, we can see that features users prefer the most are the real-time stats, the country case map, and the general COVID-19 information. Well, most of the users come to express their appreciation to the dashboard and they also leave their feature requests or bug reports to the dashboard. We further cross-compare the data with their age and find out some interesting facts. For example, for users older than 40, they tend to raise more bugs and data errors, whereas the younger ones are more likely to ask for new features, such as adding the test number and ICU number to state level, introducing the log scale to some visualizations, and also add a detailed age or gender distribution for confirmed cases. Lesson 6, users' different interactions on mobile and desktop. As researchers, we're interested to see whether users performed differently on mobile and desktop. Therefore, we take the COVID-19 case map as an example, since it has considered to be one of the most crucial parts of our dashboard according to users' feedback. We allowed users to interact with the map by actions such as zooming, panning, and clicking. The result shows on the right-hand side. We can see that for Zoom and Pen, there's no significant difference for mobile and desktop. But for Click, users are clearly clicked more on a desktop instead of the mobile, which can be restricted by the screen size or the use of mouse and touchpad by the desktop usage. Lesson 7, users' interests in the map. Apart from the interactions, researchers can further tell users' most interested area on the map by checking the total click and interactions record. Based on the data that we collected, we confirmed that the hot areas in the map are proportional to the number of active cases in the areas. Such result can help with the government to make policies accordingly and also understand the mental health stress within certain areas. In this section, we summarized the participants' experience and listed several suggestions that may help software engineer instructors to teach SE principles and concepts during the pandemic. Lesson 8, students benefit from software engineering project-based learning in the pandemic. Although there are some researchers show that university students experienced disruptions during the pandemic, the volunteer students in our project expressed that participating in such project is a beneficial experience to them during the pandemic. One of the benefits they mentioned is that participating in such project prepares them from their future works. For example, they get a chance to apply their SEIS principles and knowledge learned from lessons to a real-world project. We have the development team, data collection and visualization team, and communication team. Therefore, different types of students can easily find their roles that fits in their specialties the most. Besides, being able to work within a large community is another benefit. It helps the student cope with social distancing and lockdown by providing a sense of belonging and equip them with useful soft skills, especially their communication and cooperation skills within large development team. In this figure, we present the message volumes by different Slack channels. Lesson 9, support students through the project process in the pandemic. Well, the COVID-19 pandemic has created many unexpected challenges for the students, and they really need support from the instructors to better continue their study. Well, in our project, the instructor plays a role as a project manager. After completing the initial organizations and helped groups to break the ice, the instructor also guided the 3 main groups to work independently, including arrange their rosters, schedule the regular meetings within the teams, manage tasks, and approach to the users. Besides, the instructor also supports the students by sending emojis and responds to all the members' questions and achievements. To summarize, this is a timely social good project for developing a COVID-19 information dashboard within a limited time for solving the information needs of society during this global pandemic. This is also a case study from which useful insights may be drawn on how to properly understand and design for human values as the 3 roles a software engineer can be. And in the future, we plan to keep improving the dashboard, while we're also trying to develop a dashboard template that can be used for other emergency disasters, for example, earthquake, bushfire, tsunami, etc. And that's all I'd like to present today about our project. Thank you for watching.